Hi everyone, my name is Alyssa Wilson, and today I'll be presenting on exercise intervention for eating disorder pathology in college students. So, as a result of other presentations, we've already established the efficacy of exercise intervention in mental health disorders, and in this presentation, I'm going to be talking about an exercise intervention that I designed for implementation at Duke specifically. So, I have a brief overview of studies I want to take a look at. I have some of the more outstanding results listed here, and feel free to pause the recording and read those, but for the purposes of this assignment, I'm just going to examine the study intervention and program because it's similar in setting and parameter to mine. For these two studies in particular, we discussed them in class, but for the first study, the Cox et al. Article, we followed about 148 participants from a range of 6 yoga classes, and they were taught at a mid-sized university. They met for 2 or 3 times a week for 8 weeks, and they either met for 50 or 75 minutes, and they were taught at the beginning to intermediate levels, and there was a strong emphasis, I believe, placed on flexibility, endurance, and strength by all similarly trained instructors who were making sure that the participants were, paying attention to their breath and having present focus and just being mindful. And so for the second study, which also took place with an undergraduate population, we had a participant base with elevated ED pathology, as shown by their scores on an eating disorder examination questionnaire, and their demographic and survey information was used to produce the results on the screen. So the study in particular also took place on a college campus, and it had an all-male participant base, interestingly, and I say interestingly because, usually eating disorder studies have a largely female base, but the 93 participants were randomly selected from a pool of volunteers, and they completed the eating and exercise examination questionnaire, and the results showed that 20% of the college men showed eating attitudes and behaviors that were very similar to characteristics of eating disorders and disordered eating habits. Their exercise sessions all ranged from, they were really intense, and they were ranging from calories burned from 600 to 1100 calories reportedly, and they exercised like this for 5 days per week. And they reported exercising even past the point of hurting themselves or being sick. And they also reported negative affect, so when their exercise programs were interrupted, they were exhibiting symptoms of agitation, annoyance, anger, and they also rated exercising for physical appearance as really high. So after we've just taken a look at previous programs and literature, my intention with this intervention activity is to build on and fill in the gaps. Something we want to highlight with this and address, as seen in the previous studies also, are the comorbid factors and the symptoms of eating disorder pathology. So, we want to improve body image, physical self-perception, and internal reasons for exercising, because these are often, co-occurring with symptoms of elevated ED pathology. So regarding challenges, college is a distinct setting. A college setting, it's limited in who exactly you address. And at Duke, I'm intending to have this done in collaboration with some of the activities offered by the Student Wellness Center. So it's being offered to the Duke community in particular. And that said, a college setting, before you go out into the quote unquote real world, you can really tackle some of the more maladaptive thoughts earlier on, I believe. Interestingly, bulimia nervosa is actually, it's one of the most common psychological disorders on a college campus. And I feel like if we are addressing these symptomatology earlier on, you really have the chance to make changes in the long run. Also, speaking of opportunities, the extensive nature of the Student Wellness Network, it again speaks to the mythology of the program that I'll discuss later, but this already existing network is going to allow for easier access for those who are showing disordered eating issues. And I feel like this kind of speaks to challenges in recruiting practices, because this may present a problem. The program, hypothetically, it's going to be largely marketed as a resource, but there can be difficulty in getting people to commit and to find value in a program like this. And for those who you do recruit, there's a question of like, what exactly separates them from those who exhibit the same or even worse symptoms but don't seek help. In regard to gaps, the program won't just be for those belonging to a clinical versus non-clinical population. Ideally, it could be for both, which I'll get into later, but also we're taking a lot from what we've seen in successful intervention programs. So, we're building on and adding to similar time frames, guidance principles, exercise types. And here I have a list of the proposed guidelines by the Cook article that were speaking to successful practices that they'd seen in intervention programs that produced helpful results. I won't get too into them. We already discussed them, but I just have them here. I'll be talking about them. So first and foremost, this program is looking to really help those with elevated ED pathology, and this can be self-diagnosed or at the recommendation of a student wellness representative. And I say self-diagnosed, and I mean that in the way that if an individual is able to recognize that some of their thoughts or behaviors are a cause of any source of distress, then that's obviously different from someone who doesn't find this to be an issue. And for a recommendation through a student wellness or counseling and psychological services representative, I mean this in the way that a therapist might recommend looking into this resource to a patient who they think this would be helpful for, in conjunction with whatever therapy methods they're pursuing. And this is important because it's not being broadcasted as a yoga class just for anyone. It's going to be as a yoga class for anyone suffering from eating disorder concerns. And we don't have any specific age criteria, although in previous studies we did see that the participants were at the very least like similar in age. And so our class is being specifically offered to undergraduates and graduate students in the community. And this is because they're likely to be coming from similar phases in life, and we want this to feel as if it's a safe space. There's no explicit exercise experience needed, but of course we're going to be screening for exercise-related psychopathology, and if physical activity in any way presents a risk to anybody's health, it's just not a viable option. But it will be taught at a beginner to intermediate level, with modifications, of course, being offered for movements and poses that may be beyond the ability of some. And lastly, unlike the previous studies, we want our participant base to be evenly represented. So because we're creating a program that is not specifically tailored to a clinical or non-clinical population, spots are going to be given to those who first demonstrate interest, and we really want the group sizes to be relatively intimate for a more personalized experience, so there is a limited availability. Okay, and now speaking of methodology, we'll be making use of a vinyasa yoga intervention. We're using vinyasa specifically because in yoga, vinyasa means flow or movement or position, and it's particularly helpful in this setting because it really emphasizes the importance of being mindful and aware of your body through the breath, or as breath is referred to, and it's ujjayi. Also, seeing as this isn't just any other yoga class, the instructors are going to need to be specially selected, so we're going to be using certified yoga therapists. In yoga therapy, it has explicitly defined rules and certification processes, and the therapists in the field, they usually implement a personalized practice that addresses the disorder and illness. Also, while it's going to be a mix of beginning to intermediate level of difficulty, like I mentioned before, it's going to be a graded program, meaning it won't start off extremely difficult, but we'll build up to the harder and more moderate poses. Graded programming speaking to a tip offered by the Cook article. Also, looking at the studies we briefly discussed earlier, we're going to have a similar time frame. A semester, a normal semester, is about 15 to 16 weeks, and we're going to be leaving time for recruiting and intake So our program is probably going to be, it's going to have a time frame around 12 to 13 weeks. We're going to meet twice a week for 15-minute sessions because we want to put in as much time as we can while also being aware of the busy schedules of a college student. So one will be during, the regular weekdays and one during the weekend, ideally. So speaking of those intake and recruiting processes, as I've said before, we're planning to be heavily connected to the Duke Student Wellness Network, or DoWell. So if you were looking into the services offered by DoWell, they're pretty extensive. There's a variety of activities offered in the Student Wellness Center. They have holistic wellness offered, Kuru mindfulness, which teaches like meditation and manage stress, integrative health coaching. For this program, we do intend for it to be integrative as well. So it's going to be offered in conjunction with Duke Nutrition Services and Counseling and Psychological Services, or CAPS. And we're using the team approach talked about in the Koch article, where you have a multidisciplinary team of experts who are going to work collaboratively. In this case, it's heavily dependent on the participant to seek out the services as well, and we'll encourage that. But in this case, the different facets of the program are going to build off of each other. So for instance, the therapy aspect, it might make use of cognitive behavioral therapy, which I don't 100%, I'm not fully able to talk about that, but in my normal psych class, we spoke about one of the first steps with that form of treatment being, informing participants of like the ineffectiveness and the dangers of binging and purging, of self-starvation, of dieting, and how it doesn't really have effects in the long run, and then coming up with adaptive responses to the situations that are causing stress instead. And with nutrition services, the participants are going to be learning how to properly nourish their bodies and their minds. And I've used the nutrition services offered before, and I did find them helpful. And also, because ED pathology, like generally patients with it have disturbed social relations, we're hoping that the group exercise class is going to contribute to a socially enriched environment, because this form of exercise can help in improving social behaviors, and it can also help because instead of ignoring the role of exercise and what it can play in some aspects of ED pathology, these participants are going to learn how to restructure their view of it. So exercise in general, it has so many benefits, psychological, physiological. And by using it here in a constructive environment, you're going to be able to adaptively translate it to a healthy exercise behavior in an uncontrolled setting. And speaking of setting, the classes are going to be ideally held in one of the student wellness classrooms. I have a picture of one here, and I chose it because I feel like it looks out into this just serene environment. It's a really nice room. And now talking about evaluation and assessment methods, this program, I don't want it to feel too much like a scientific experimental study, so I want it to be more of a personable intervention. And so because of this, I'm only intending to use 3 studies that test comorbid factors of eating disorders, and I've chosen the positive affect and negative affect schedule, and this test for mood through the series of 20 adjectives that they refer to your emotions and how you've been feeling. And then for self-esteem, I'm going to be looking at the Rosenberg Global Self-Esteem Scale, and this is through like a series of 10 statements that it relates to your like sense of self-worth, and you rate them on a 5-point scale, and it ranges from like strongly disagree to strongly agree. And finally, I'm going to be using the social physique anxiety scale to test for body image, and it does that with a 9-item questionnaire that you also rate on a 5-point scale. And although I don't want to be constantly testing the participants, I do want to have results that are as valid and reliable as they can be. So over the course of the semester, we're going to have 3, one at the beginning, one at the end, and one in the middle. And I don't really want to rely on a lot of retrospective self-reports, so that's how I chose like the placing, the timing of them. Thank you so much for listening. But on a final note, I just really want to reiterate the positive benefits exercise intervention can really have in regard to mental health. Thank you.